Hi guys, I am back with my week 4 results, and in this installment I'm going to talk about the Ozempic trial a little bit and compare that to Saxenda trial. So let's jump in. In week 4 I lost 0.8 pounds or zero point 0.1 on the BMI. Yes, and the total loss for the 4 weeks is 6.6 pounds for me. Now let's talk about the trial. About a month ago, a medication called Ozempic, generic name Semiglutide, was approved in the United States for weight loss. In the dosages that is required for weight loss, it's going to be called Wegovy or Wegovy, which is a really odd name. Now let's do a pre-story for you. Both Liraglutide and Semiglutide have been created by Novo Nordisk as diabetes type 2 medications. And when the diabetes trials were taking place, the company realized that people were losing weight. They weren't quite as hungry as they were before because this particular peptide receptor agonist was impacting their brain and telling their brain that they're full. As they tried it for diabetes type 2 at relatively low dosages, what they found was a weight loss. For example, for 0.5 milligrams of semaglutide or Ozempic, people on average lost 9 pounds. So what the company had done, they retested that medication for weight loss. And the same story kind of happened with Saxenda and now with let's go with semaglutide, okay? So it happened with semaglutide. And what is interesting about it is that for diabetes type 2, the dosage is about 1/5 or 20% of the dosage that is used for weight loss. For example, for semaglutide, the regular diabetes dose is 0.5 milligrams, and a lot of people are on 0.25 milligrams, and they're still losing weight. That tells you how oddly stubborn obesity as a condition for medical treatment is, because diabetes type 2 is really a stubborn condition, and it takes a lot less of this medicine to treat. To summarize my research of clinical trials, the difference between semaglutide and liraglutide are that Ozempic semaglutide or Wegovy is about 3 times as potent in terms of weight reduction, and you also have to take it only once a week as opposed to every day. Let me go into the detail. The arm that took 2.4 milligrams of semaglutide lost 14.9% of their body weight, and that is the result that you see reported a lot, 15% body weight with Ozempic or semaglutide. However, this was not the only intervention in this study. Both arms took nutritional counseling and were encouraged to exercise more. So those who took placebo lost 2.4% of their body weight. So the impact of semaglutide alone was 12.5%. Now let's review Saxenda or liraglutide study. Those who took 3 milligrams of Saxenda daily lost 6% of their body weight, and those who took placebo lost 2% of their body weight. So the impact was about 4%. So 4% versus 12.5% is where I'm talking about 3 times as effective. Now, the liraglutide study also had an arm that took 1.8%. Interesting, and these people lost 4.7% of their body weight, less placebo is 1.7. So about 2% of body weight they lost on a lower dosage. And that brings me to my story. And the story is that when I was picking up my medication, my doctor, when prescribing it, put the dosage at 1.2 milligrams. And the pharmacist told me that I'm supposed to increase my dosage. Otherwise, it won't work. And that is not true. So as we have seen with prior clinical trials, specifically the ones for diabetes type 2, when a much lower dosage of this peptide agonist was used, we saw there was some weight loss in this medication, particularly for Ozempic, which people lost 9 pounds. This is not insignificant on a dosage that is approximately 20% of the full weight loss dosage. And guess what? Additional studies exist for Saxenda where they tell you how much people lost on Saxenda at even lower dosages, like 1.2 milligrams. So this, going to refer to my computer, this European study, Liraglutide Saxenda was administered at 1.2, 1.8, 2.4, and 3.0 milligrams, plus obviously placebo. The weight loss, it's not in percentages, it's in kilograms, was 4.8, 5.5, 6.3, and 7.2 kilograms respectively for the Saxenda arm and 2.8 kilograms for placebo. So what we see is good evidence of this medication being more potent at higher dosages and less potent at lower dosages. So, and this is why getting a lower dosage of this medication is okay by many doctors, and it is okay for me. Now, my dosage right now is 0.9 milligrams, and you're going to say, well, you can't take 0.9 because there is no such mark on the pen to take 0.9 milligrams. However, if you ever use the pen, you're going to see that when you turn it, it produces clicks. And if you count the clicks, there are 10 clicks per 0.6 milligrams. Guess what? If you have 0.6 and 1.2 at two ends and it's 10 clicks in between, then if you do 5 clicks, then you're going to be at 0.9 milligrams. This is what I'm taking right now, and that is a good dosage for me. So let's go into side effects. Side effects have gotten better for me. I still have a little bit of fatigue, but I don't have nearly as much nausea or dizziness associated with this medication. So I'm taking my 0.9 milligrams at night around 11 p.m. before I go to bed, and I wake up relatively normal. So I'm the kind of person that has more energy in the afternoon, and by the afternoon, most of the fatigue effects of this medication is going to wear out. Now, going back to clinical trial, there was additional information that I found that is not usually publicized, and it's not exactly positive. So I'm going to do more research on that and report to you next week what I found. If you like this video, give it a like, and if you would like to find out where my Saxenda journey takes me, subscribe. I will see you next week.